Hello, welcome to NU 621 Advanced Pathophysiology. I am Dr. Nancy Tierney, your instructor for this course for the next 8 weeks. I think you will be energized by the rapid pace and all that you already know and all that you will learn. I believe that advanced practice nurses are and will be at the forefront of the healthcare reforms that are ongoing and will continue for many years. The fact that you are here excites me. I am honored that you are taking this course. Let me give you a little bit of my background. I'm an acute care nurse practitioner. I currently work at the University of North Texas Health Science Center in Fort Worth, Texas. I work in the cardiology division as well as coordinate the simulation center. I also teach in the Texas College of Osteopathic Medicine here at the Health Science Center. I received my Bachelor of Science in Nursing degree from Marquette University College of Nursing in Milwaukee. I got my master's degree in nursing at the University of Wisconsin-Milwaukee and my PhD from the University of Texas at Austin. I really enjoy teaching and learning. I really believe I learn as much from you as you hopefully learn from me. I'm a firm believer in taking time for yourself, however. This course, as well as other courses you will take, provides a lot of stimulation and a lot of information. So be kind to yourself. Give yourself a break. Take a deep breath. You are embarking on a journey that is lifelong and has tremendous rewards for the rest of your career. It is important to keep your perspective and keep your well-being, and the ability to learn will be enhanced by treating yourself kindly. I want to give you a little roadmap for what you will be experiencing as well as what the expectations are for this course. You will find that it is a rapidly progressing course. I approach it from the 4 tasks that healthcare professionals, including advanced practice nurses, perform every day. These 4 tasks are diagnosis, treatment, management, and explanation. You diagnose, treat, and manage, and then you explain why you are doing the other 3 things. Of the 4 tasks, advanced pathophysiology fits in with number 4, explanation. Advanced pathophysiology is the explanatory piece of patient care. It explains what is happening and why it is happening. Specifically, it explains the symptoms the patient is presenting, what changes are occurring in the body, as well as the basis for the disease and the diagnosis. You will be amazed at what you already know and understand, and be amazed again at the detail with which you will become familiar. This course certainly requires a fair amount of memorization of facts, but I've tried to make it more meaningful. The assignments and the discussion topics provide opportunities to apply the knowledge you have acquired to patient care scenarios and in situations you will encounter every day. You will notice there are course objectives, unit objectives, discussion topics, assignments, and due dates. This is pretty standard throughout all the courses here. Let's review the overall course learning objectives. Number 1, compare normal anatomy and physiology to alterations in function and regulation of body organs and systems in response to stressors. Number 2, correlate clinical signs and symptoms and diagnostic results with the development or progression of disease processes. Number 3, examine the way in which known or suspected lifestyle practices disrupt the normal homeostatic mechanisms of major organ systems. Number 4, propose therapeutic interventions for identified pathophysiologic processes considering age, ethnicity, gender, and the comorbidities of the patient. Each unit will have specific objectives. The objectives you see here are identical for each unit. We will be covering 2 major systems each week, and the only thing that changes in the objectives for each unit is what is highlighted in yellow. In other words, when we are starting the nervous system, the cardiovascular and lymphatic systems highlighted here will change to nervous system. There will be 2 focused discussion topics each week. I see these as a vehicle for you to interact with your colleagues. It is not so much for you to present more information that you obtained from the textbook and other sources you've chosen. I want you to take that information, think about it, put it in your own words, and then discuss with and challenge your colleagues. There are 2 weekly assignments each week except week 7, where there's only 1 assignment. Each assignment has multiple parts. Be sure to address all the parts. I expect it will be written as a scholarly paper and not as a bullet-pointed outline. The more detail you give me, the better. I give lots of feedback. My major question is why? Why did you say that? Why is that happening? I want you to delve down deep and explain. You will be graded on and expected to use proper APA format. There are great resources in the Library tab in Blackboard. The librarians are there to help you, and they have provided great links for learning how to use proper APA format. Most of us don't memorize the format because it does change, so when I write a paper, I keep it open so I can refer to the resource while I am writing the paper. There is a final project that is due midweek 6. Please note that in week 3, there is an outline of your choice of topic that you are going to write your final project. The final project is a review of literature on the topic of your choice related to this class. There are videos provided in Unit 6 to help you learn how to write the outline and how to write a review of literature. It is a little bit different than what you're used to. It's more than writing a paper and quoting specific resources. So be sure to watch the videos. Please read the syllabus. You're responsible for its content whether you read it or not, so you might as well be familiar with it. All the due dates are there for the entire 8 weeks. Take time to organize your timeline and figure out what to do when and how you can meet the due dates. Remember, Easter weekend occurs during this course, but you are still expected to get your work in on time. Also, the grade summary is included in the syllabus. Please communicate with me. Call me. My cell phone number is listed in the syllabus. You can send me a message through Blackboard. If you're having some difficulty or you have questions, don't wait. We can usually work it out as long as I know what's happening. Please communicate with me. I give lots of feedback, so don't be intimidated. I am here to assist you on your journey. I want to thank you for your time and welcome to the course.